Hi Caitlin. So like we said, we're videotaping this for open colleges. No one else is going to see it except for me and my assessor, and it's just for my assessment purposes. And yeah, just that we've gone through that.
Yep.
So we're going to go through AWPTAs today, which is, do you know what it stands for?
No.
No. So it's the abbreviated Westmead post-traumatic amnesia testing. I have a vague idea of what it's for.
Anyone with a head injury to assess how amnesic they are toward them and to see if they're
That's right, except it's mainly for mild head injury rather than any head injury. So we're looking at more of a GCS between 13 and 15. Can you think of any other indicators that you might test somebody for AWPTAs, with an AWPTAs?
Other than head injuries? Or
so what would just sort of go through what the indications would be for what type of patients? So example would be GCS 13 to 15, yeah.
Do you mean like someone who's fallen off a bike?
The mechanism, what their mechanism was, if we think that it's suspicious of, we think there might be a head injury.
Yeah, so trauma, like
Okay, so we were talking about indications. So, like you said, anyone with a mild head injury, you're looking at GCS 13 to 15. Anyone less than that is excluded. And we also exclude anybody who's got documented bleed on a CT. They need to go to formal PTAs, PTA testing, which is over 3 days. The reason that we brought this in is because we were bringing in, we were admitting people to the wards for 4 days just for PTA.
Yeah.
And this way, it's an abbreviated way, so it means that we can clear people, they can go home on the first or second day instead of staying for 4 days.
Yeah.
So we're just decreasing that length of stay. Other exclusion criteria are if they're over 70, just because they might already have some sort of pre-existing illness or something that's causing their memory to be not that great. So this folder is kept behind. This folder is kept behind the TC desk in both halls, and there's also one in recess. And it has everything you need in here. So it's got the forms. It's also got the protocol, which I've printed you off a copy of, and you can keep. And it's also got sorry about that. So I was saying that it's also got the head injury advice sheets for the patients when they go home, if they go home. So it's just got information there for them. So you said you've been showed it briefly before, or yeah. So very similar to a GCS chart in the first block of it. So scoring in the same sort of way. So eyes opening, obviously, spontaneously to speech, etc. The difference, and I like this about these, is that they've actually got what the criteria are for someone to get an orientated, whereas a GCS, you don't have that differentiation. You can sometimes cheat and give them a 5 and they're not really a 5, so it's actually got specific what they need to get right. Otherwise they get confused. You can still start it if they are a GCS of 13, but you just need to keep going and see what they achieve later. So the first one is exactly the same as GCS. You do a GCS, power, eyes opening and closing. The only difference is that you're giving them the picture cards, which are the picture cards on the front. So you can show it to them, get them to repeat what they are, and then ask them that you want them to remember them for in an hour's time. You'll come back and ask them what they are again. That's really all you need to do for the first hour, and obviously just initial it like you would anything else. For the next time you come around, and then every time after that, until they get a full score, so 18 out of 18. You'd come and do a GCS and then ask them what the pictures were.
Yeah.
Sometimes people might be able to remember what the pictures were without you giving them any prompts, which is fine. Otherwise, you can show them the pictures that are on the back as a prompt and just say, which ones were they? And you can just put a little asterisk. So you can give them a 1 for the yes, or a 0 for the not getting it. And you just put an asterisk next to the 1, and just when you write your note, explain that needed a prompt, a visual prompt.
And if they need a visual prompt but can get them, is that still passing?
It's still passing. Yeah. As soon as they've got an 18, that's it. You don't need to do it ever again.
Yeah.
It's done. And that's it. But if they haven't got an 18 yet, you just keep going until they get one. Yeah. At 4 hours time, if they're still not getting 18 out of 18, that's when you should go to the doctors and say, well, they're still not scoring in their AWPTAs, they need to consider admission. Likely they need to do either a formal PTA, or if it's another reason, so if it's drug induced, or if they're intoxicated, for example, we can still do it within 24 hours of admission. So if the next day they've sobered up, we can do another AWPTA, and if they pass it, that's fine, they've passed it. Have you got any questions about that?
No, that's straightforward.
That's pretty straightforward. So just once they've gotten an 18, and if they decide that they've got no other injuries and things like that, and they're right to go home, then you just need to make sure that they're going to somewhere safe, where there's going to be somebody else there with them, just in case they do end up getting something else, like an extension of a bleed or whatever it is that wasn't picked up. And then just give them, so verbally tell them what the head injury advice would be, and also physically give them a handout so they can read that at home again if they need to. So what type of advice would you give someone who's going home with a head injury?
If they get a sudden onset of pain, or any change in like if they start getting confused again, or if there's any change in their alertness or behaviour, to if it was me, I'd tell them to come back to hospital.
Yeah, that's right.
Don't drive for a while until you're feeling better. If you get nauseous or vomiting, come back.
That's pretty much it. So you're right to tell them the warning signs. So anything like a severe headache, vomiting a couple of times, seizure activity, only behavioural changes or cognition changes, to come back for those. Also, to avoid, you've said it right, to avoid driving, but also to avoid alcohol and drugs, and to avoid sport for at least 24 hours. And also just to advise them that if they've still got symptoms over the next couple of days, like you can just warn them what the symptoms of concussion are. Most people will have a little bit of a headache, and it can last up to a couple of weeks, and nausea as well. It's just if it's that increasing, then they need to come back. But if it is becoming problematic for them, they can always see their GP or come back to emergency. Either way. I don't think there's anything else to go through. Did you want to try and go through it? Or is it straightforward?
Yeah, I've done a couple before.
Okay.
If not me too, I will.
So just sort of what type of questions would you ask? This is my reading. Like what would you ask in the orientation?
Can they tell me their full name and date of birth? Where they are at the moment? Why they're here? What year is it and what month is it? And for day of the week, I don't know, sometimes that's hard, but I can probably ask that too.
And with the place, just make sure they say the full name of the hospital, not just of the hospital, or not just
in Colborough.
Or I'm in Sydney. A lot of them will say I'm in Sydney.
And
like, or we're in Sydney. Like, you need to be more specific. Yeah, and just with the cup keys bird, it doesn't matter how they choose to remember them or whatever, it's just that as long as they remember them.
Yeah.
Yeah.
Yeah. Cool.
Okay, have you got any questions?
No.
Right, so I'll leave you with the protocol so you can have a look at it at home.
Yep.
Again, if you wanted to, or whenever you get time.
Yep.
It goes through everything pretty much that we've just been through in detail.
Yep.
And thank you.
That's right.
Oh, just one more thing. So with the yellow and the red zone,
yep.
it's just the same as what a GCS would be. If you get a drop in 2 or more points, then it's a
medical review.